And now I would like to give floor to UA Med founder, Dr. Douglas Davis, who is going to tell us about the experience of Ukrainian-American cooperation in the medical sphere and about the innovation partnerships that can support the Ukrainian medical staff in today's conditions.
Добрий день. Does everybody hear me? Let me take this off. Мене звати Dr. Douglas Davis. Я рада, що ви прийшли. That's the extent of my Ukrainian. I apologize, but I'm very honored to be here again at Shupyk. I want to thank our hosts here at Shupyk and all of our partners who helped make this happen. And before I start talking today, last year when I gave the opening for the second International Health Summit, we decided to open with a memorial. And the memorial to recognize just how much and how profound the losses for Ukraine have been. We're here as your guests. We're here to help. And we're here to recognize just how much Ukraine has sacrificed for the whole world. And so, to put a name on it, this is my wife's cousin, Mykola Zalishchuk, and he was killed in the first summer of the war. His sister, who's there next to him, has written a book about that, and just that catalogs just how much loss there's been in this war, but also how resilient Ukraine has been in responding to that. So this is in his honor, this is in honor of all of the heroes of Ukraine, but to put just a single name on that and to ground everything that I'm going to talk about today in respect for that, in respect for what Ukraine has done, because what are we here to do? We're here to build partnerships, we're here to share and learn from each other, and we're hopefully going to walk away all being friends and working, more collaboratively and more productively together. And so, let me see if this works. So what I'm going to talk to you about is the Ukrainian Alliance for Medical Exchange and Development, where our motto is Sapientia Paranum Sitem, or wisdom through friendship. Because what we've realized over the course of the past 4 years, collectively we've done a lot of things, but we've always been the most productive and the most impactful when we worked together and we developed partnerships. And just to give you a little bit of a background for how we've gotten to where we're at today. So, full-scale invasion 2022. People from across the globe began mobilizing humanitarian effort. Those of us that were in the healthcare space were obviously mobilizing medical aid. We spent, the first year really in disaster response, sending tons and tons of material medical aid. And as we were doing that, a lot of us were meeting new people, meeting different organizations, new partners, and trying to figure out the ways that we could maximize the returns on investment, lower cost, get the biggest impact, the biggest, as we say in America, the biggest bang for our buck. So we also recognized and got a very early feedback from Ukraine that the challenges for the healthcare system were extraordinarily dire. The system, was stressed with the largest number of, combat casualties, other type trauma casualties, immediate, mental health crises. And so we also started to begin to organize observerships for Ukrainians in the United States and in Europe. And those began in August of 2022. At the same time, we're traveling to Ukraine with many of our partners, trying to offer the best help we could do to do training to elevate levels of services, to provide new technologies. I'm a radiologist. I carry an ultrasound as my weapon. Probably things, POCUS training, but combat casualty care, the highest levels of military medicine that we could offer to the Ukrainians. So we were developing this growing network of people both coming from outside of Ukraine, but finding and identifying great partners within Ukraine. We were doing trainings, conferences, publications, basically learning and sharing with one another, building friendships. And so the other thing that was happening too was that donations, the charity that was there in the early parts of the war, it became harder and harder to get the donations to support a lot of this work. So we realized we really needed to do more work together to reduce redundancy of efforts, to share our expertises so we would really do the most to benefit Ukraine. And that's when we decided to organize an alliance, the Ukrainian Alliance for Medical Exchange and Development. And one of the key words in that is exchange, because Taras has alluded to this. There's a lot that we can bring from our country, but a lot of it won't fit here. Ukraine is unique, and I speak to this knowing this because I'm part of a Ukrainian family that has six physicians spanning 3 generations. I've been coming to Ukraine since '99. I've been visiting all your hospitals, and I try to learn about that because there's a lot you can learn from us, and there's a lot we have to offer, but we've actually learned a lot from all of you. And there's also things that we should recognize when we come here. There's a lot that's great about our systems, but there's also a lot that's bad. So we'd like you to learn from our mistakes as well. So this conference is now the first of a series that we're going to be continuing to organize. We're going to have a conference in Lviv next week, and then one in Harvard in November, but this is going to be a continuing process. But I just want to give you a little walk. This is some of the core group of academic medical scientists and physicians in the United States. Each of us, been a representative of, our faculty at some major academic institutions in the U.S., Harvard, Yale, Stanford, some of the major state universities. This is the group that decided to shape and form this alliance. We have online presence. We've been working with, numerous NGOs, dozens at this point. These are some of the original core non-governmental organizations, charity organizations that were a part of this. And so UAMed itself, it's not an NGO. It is a mission. It is a mission to form more partnerships, more friendships, to do more through alliance. So it's humanitarian focused, it's self-selective and self-organizing. Honestly, the way that all of us began working together is we realized we were all doing the same thing, and we were all repeating a lot of the same mistakes or redundancy of efforts, and we figured that if we all started working together and sharing and collaborating and using our resources together, we'd be able to accomplish much more. So it's an open alliance. Anyone is welcome to join who has healthcare focus. And we are focused on collective strategy, maximizing returns on investments, sharing resources, reducing costs in that manner. And this isn't theoretical. This is what we, objectively have done to date, where we've literally come in contact with thousands of physicians in Ukraine that we've been involved in helping training, providing educational programs. We, by the end of this spring, will have had over 400 Ukrainian physicians in the United States and Europe to do training in our hospitals at some of our top academic centers. We have hundreds of sponsors and contributors in the alliance. There's over 50 NGOs and other academic partners that are involved at this point. And we have actually produced real results because one of the things about the exchange is there's a lot of knowledge and innovation coming out of Ukraine in the healthcare, out of the necessity of the war. Combat casualty care guidelines are being rewritten based on what's happening in Ukraine. So based on what we're learning in Ukraine, we're taking that, and this is important for Ukraine, we're doing peer-reviewed publications in academic medical journals. We're helping to build the academic acumens and CVs of Ukrainian physicians so that they can go out on the world stage and be recognized for the marvelous physicians that they are, and that all the things that they actually have to share with the global medical community. This is now just in the past year or a year and a half. This is one of the 10th conferences we will be doing before the end of this year. What are our core domains? Where are we focused on? So we sort of categorize it into 5 main areas. The first of that's clinical training. The second is helping to host conferences where we can establish these relationships, share knowledge, and build further partnerships. We have been hosting or bringing Ukrainian physicians to some of the biggest global conferences around the globe, the biggest academic medical societies, so that the Ukrainians are on the stage presenting to the world everything that they're learning from this war, all of the innovation, all the healthcare technology that's coming out of it. Fourth domain, as I mentioned, we've been doing peer-reviewed publications, and this is important on multiple levels. It's important because, one, historically, and I know this because my wife's family comes from this education system, you don't get the training as broadly here in how to navigate the process of international peer-reviewed medical, and so Ukrainians don't then have the CV, because in our world in academics, we call it publish or perish. We are defined by our publications, but it's even more important than that. Publications are the credentials not only of the physicians, but of the academic centers and the institutions that they come out of. And that is important because we want Ukrainian institutions to be seen as centers of excellence that they are. Publications are something that help do that. And that then leads to something that's important. It leads to research dollars. And we think that's just one mechanism that will help Ukraine in terms of its capacity building for the future. Lastly, we have established this group as a global or as a communication and coordination platform. So we have electronic ways of doing it, we have online resources. I hope you have all joined our WhatsApp community, and I'll show you the QR code so you can, if you haven't already. And we are working with the key government bodies in Ukraine and also in our countries as well, to make sure that we maximize the capacity building that's coming out of this. And so that we can actually get the exchanges of exactly those things that people like the Honorable Mihailo Radushki of your healthcare committee was talking about, to help empower Ukrainians to self-govern, to say, here's how we do it. See if it works for you. If not, try something else. So core domain number one, clinical training. That's training that we have done both in Ukraine, and we do that both in person, but we also provide virtual resources, but we also observerships, fellowships abroad. And so here's just a sampling. This is a program at Oklahoma University that's done over 30, I think actually 60 trainings of observers. This is my wife. Where's Dr. Elena Rencas in the audience? She's a National Cancer Institute physician that trained in traumatology. I see you, Elena. With my wife at her institution in Wisconsin. This is our colleagues at Yale, where my wife and I trained. They've done, I think, also in the dozens of fellowships. Peace and development. They've helped observerships at more than a dozen different of the top, institutions in the United States. Johns Hopkins, Northwestern, others. Our Harvard-based group also done dozens of fellowships. Stanford group. So we've involved some of right now, Dr. Katerina Minko of your Ministry of Health and the National Cancer Institute. We were passing each other as I was coming into Korea, and she was going to my hospital in Milwaukee, and I'll be hosting her fellowship when I get home. But the point is, we've had incredible exchanges from that, and one of the key points that I think that it's when these people come to our country or to Europe and we do these trainings, they take, they're there to learn from us. But honestly, a lot of the people that run the programs end up saying, we've learned incredible things from the Ukrainians that have actually, changed people's practices. Because here's one thing about Ukraine. Every time I go home from Ukraine and I go to my hospital and I work there, I feel ashamed, because I see how much waste and excess we have in our system, and I see how much Ukrainians do more with less, that our physicians in the United States are spoiled. So I'm always a little bit of ashamed, and that's been something that's been important as a part of this exchange, for our physicians to meet your physicians and to see just how resilient and innovative and entrepreneurial and they are. So hosting conferences, we've done many of those, and a big purpose of that is so that we learn from you what you actually need from a healthcare standpoint, and we try to learn from you all of that you're developing out of it. You're here at the 3rd International Health Summit. Next, I'm leaving here on Wednesday to head to Lviv for our quality and safety forum that we're doing there and leadership in medicine on Friday and Saturday. In November, we'll be bringing many of our colleagues over to the United States for our conference at Harvard, because we want to give that voice. There's a lot of people that can't travel here for a variety of reasons, so we also want to make sure that you're coming to us and that your voice is heard. We have been sponsoring physicians from Ukraine coming over and presenting at global academic conferences throughout Europe and in the United States. This was a physician from Lviv, presenting with me at the Radiological Society of North America in Chicago last winter on all of the advances in combat casualty care and as they apply to radiology at the RSNA in Chicago. This is us at the American Society of Clinical Oncology, the largest cancer organization in our country, presenting on a publication about these observership programs and the benefits we've seen coming out of them. The peer-reviewed journal medical article. So here's an article that we published with some of your Armand Kasharan from the Ministry of Health and others, helped us put this together to talk about what has been the impact. Because one of the things we do when we've done the observerships and thing is we make sure that the Ukrainians that go back, they make sure to share what they have learned. And part of that's through publications, part of that's through taking, deploying the knowledge and guidelines that they may have learned in our hospitals in their own. And we talk about that here. But just to give you an example, this is just the current running list of more than 50 publications that have come out as a byproduct of all of this collective effort. And I point to one in particular that was just recently published in the Lancet, and this is important. Lancet is considered a top-tier medical academic journal. Ukraine there had only been 2 articles ever published previously originating from Ukraine in the Lancet. This is the 3rd, but we have 2 more in preparation or submission just to that. So the point is Ukrainians are getting published in some of the top-tier medical journals in the world now. This is one of our top founding members, Haley Urand. She's an infectious disease doctor from Australia who has been in country working with both with your veterans and at civilians, managing some of the worst effects. She was the lead author on that. Finally, the enhanced communication platform. So as we've developed all these relationships, we've tried to actually make sure that we're doing them in best coordination with the government entities, which can maximize the capacity building that's coming out of this. We've signed MOUs with several entities, the Ministry of Health, the Verkhovna Rada with Mihailo Raduchki, with the Youth Ministry, or the Youth Council of the Ministry of Health, but also with so this is with the Rada and the Ministry of Health with Mihailo Raduchki and your Minister Liashko. We have also signed, MOUs with the Ministry of Sports, which might not seem intuitive at first, but I want to make the argument that one of the more successful programs we've seen, particularly in mental health and rehabilitation, has been the use of sports as good medicine. So this is us signing an MOU actually with Valery Suskevich, the head of the Paralympics Committee, where he helps run one of the most premier rehabilitation programs I've ever witnessed, and I mean in the world, which is in the Carpathian Mountains at the Ukrainian Paralympic Center, where your veterans, amputees, train side by side, rehabilitate side by side with Ukraine's best Paralympic athletes. It was a model facility because it was already developed before the war even existed to help train the top-notch, disabled athletes. And they're now tying that to mental health programs and community-based, family-centric programs. So it goes to, we're also, in everything we're doing, we're trying to think creatively and innovatively of how to address the size and the scale of the problems that Ukraine's faces from a healthcare standpoint, but do so in a way that is unique to Ukraine's realities, to its culture, to how its civil society works. And so this is the group. We've had over 50 plus signatories on our MOUs. And this is the network that over the course of the 4 years we've developed to try and maximize our ability to effectively, do exchange of medical expertise and knowledge and alliance with Ukrainians. So that the non-governmental organizations, the charities, the academic organizations which the faculty have done the training come from, and the government organizations on your side that have been a part of it. So if you can pull out your phones right now, I want you to QR code that, and if you do, you'll get a present. You'll get a present. You have to wait till after I'm done talking.
While we're QRing code, I just want to thank Doug Davis for spearheading this UA Med. It was a lot of work that he had to put in and get us all on board, and I thank you.
Thank you. Okay, so hopefully you QR code it, and did I lose my presentation? Oh, so if not, you will get the link, and we'll send. And I'm going to make sure to share all of these things again, but. Make sure you follow us on social media. We're on LinkedIn. We have our website. And also, what I was saying, as I said at the beginning, I hope that, through this, we all become better friends. And we all, find me on Facebook. Let's become friends on Facebook. But here's another thing that I like to tell Ukrainians. Don't do your professional social media on Facebook. I encourage everyone to get on LinkedIn. And I've actually seen the most growth of Ukrainian presences on LinkedIn. This is your professional CV online. This is a way for you to connect with other professionals. So find me on Facebook, find me on LinkedIn. If you haven't created a LinkedIn account, please do. I want to give credit to my friend Thomas Humphrey, who's our IT, who helped me to put together this talk. But I want to say Duży Dakiu. And so this is my Ukrainian family back home in Wisconsin. But like I said, six physicians spanning three generations. Actually, Bops is not in this, or older Bops is not in this picture. So at least the 2 generations. So thank you all.
Thank you. Thank you, Dr. Douglas. Thank you for your insightful presentation, and thank you for your experience that may be more useful for Ukrainian doctors. And I have one question for you, maybe another question from my colleagues. What forms of collaboration or maybe collaboration between Ukraine and USA, like online compatible program, exchange, are currently most realistic for supporting Ukrainian doctors in primary level?
So what I would say is that one of the things about the alliance is if you look up on that, all the groups that are involved, all the individuals that are involved, each one of them is very talented at certain things. One of them, for example, Global Medical Knowledge Alliance, one of the ones I'm on the board for. We've got online platforms for disseminating information in the United States, a lot of physicians use a thing called UpToDate, which provides the highest levels of standards of care for you name it, from treating a cold to doing, colorectal surgery. Global Medical Knowledge Alliance is trying to build a platform to make that translated Ukrainian language, Ukrainian accessible for free, but also knowing that there's some differences in like, for example, you see some diseases in Ukraine we don't see. Cystic fibrosis disease, you see very often some advanced cases, spinal muscular atrophy. So we're trying to make sure that even those resources are updated in a way and made available in a way that's unique to some of the healthcare conditions you see in Ukraine that we don't commonly go with. But so that's just one platform. We have other groups that are doing virtual training of surgeons, of physicians, basically being able to video link operating rooms. And then again, the different ones of these organs, for example, MedGlobal or Razom, I think some of our Razoms are, they send teams into Ukraine that actually come and do the training in person. So what I would say is the power of this alliance and why we created it was because we recognize each individual and each group had certain talents, had certain expertises, and we wanted to create a platform, be the UA Med platform, to basically, link the right people up, in the right space and time, to maximize collaborations.
Thank you. Thank you. Please, other questions from another colleagues? Maybe Miss Natalie? And the question, according to the special, maybe a new curriculum for medical universities or institutes, or not? Please. Okay. Thank